Well, today we saw Alistair Darling stand up in Parliament and announce his plans for the next 3 years for the NHS and all the public sector in terms of spending. The NHS has done pretty well, actually, especially compared with other spending departments. The Chancellor said it will get another 4% real increase every year for the next 3 years. That's higher than other spending departments. And it will take, if the other countries, Scotland, Northern Ireland, Wales, all follow suit, it will take UK healthcare spending to within touching distance of the average for our European Union neighbours. So it's done pretty well. I think the NHS is going to be pretty pleased with this settlement. It's not unexpected, I should say. It's been well signalled from the Treasury over the last year and a half that the growth in NHS spending is going to slow. And the predictions were something from just below 3% to nearly 4%. So I think it'll be reasonably pleased. We're in a better financial state in the NHS. We have had deficits in the last few years. Looks like we're heading for a surplus this year. We had a surplus last year as well. Foundation trusts have built up quite large reserves, nearly 900 million, getting on for £1 billion. So the NHS has been planning for a sort of slower growth future. The other thing we can look at is a report produced by Sir Derek Wanless in 2002 for the Chancellor, the then Chancellor Gordon Brown, who asked Sir Derek to come up with estimates of how much the NHS should spend over the next 20 years. And Derek did it in pieces. So the last 5 years he recommended something along the lines of about 7.2, 7.4%, which did go into the NHS. For this next 5-year period, he recommended not 4%, but a bit more than that, 4.4%. And that was predicated on, well, two things. The NHS working harder, being more productive, better use of ICT, and so on. But also in terms of the public's role in this, being more engaged with their health, obesity trends going down, not up, smoking trends going down, and so on. So, there were assumptions built into Wanless's figure. So we're short of that figure with Wanless. And not only that, in fact, a review that we did recently with Derek Wanless suggests that the NHS has not been achieving the sort of productivity improvements that Wanless assumed. And also some of the sort of determinants of health, obesity is a classic example, have gone completely the wrong way. I mean, I suppose one of the questions is how this will all impact on, will patients see a difference? Will they see fewer staff and so on, hospital closures, or longer waiting times? I think not, actually. We have to bear in mind that this is still a real increase. The healthcare in this country will take a bigger share of GDP than ever before. So, the money is going up. It's just going up at a slower rate. Now, can the NHS deal with that? Can it deal with that money and also meet its targets, not just on reduced waiting times, maximum wait of 18 weeks, but reducing MRSA, big concern of patients and the public and so on. Well, it hasn't done too badly. The King's Fund produced a report earlier this year where we tried to look at the future of social care funding. It's a very complex area. It's much more complex than the health service. Most of the money for the health service comes from general taxation. We all agree, most people agree, that that's the fairest way of paying for health care. In social care, it's a real patchwork of funding from the voluntary sector, from individuals' own pockets. There's means testing and so on. It's quite a complex system, and generally not particularly fair or efficient, I think, in terms of the money. The report that we produced along with the LSE, London School of Economics, and Sir Derek Wanless again, looked at how much money we're spending now, about just over £10 billion on social care, and then looked forward. We know we're going to have a rising numbers of elderly people, so that there are going to be more needs out there to satisfy, and even just satisfying that growth in the population is going to take another quite a massive spending, up to something like 24 billion by over the next 20 years. One very welcome announcement from Alistair Darling today was that they'll be developing a green paper on social care funding. Now, a green paper is really a paper putting forward ideas for debate and discussion. So we would hope to take part in that discussion, and we hope other people will too.